Living well in Panama is not just about emergencies. It is about building a routine for checkups, medications, specialists, and prevention.
This Panama Healthcare series shows you how to plan for care, from insurance and emergencies to hospitals, pharmacies, and chronic conditions.
Hey everyone, welcome. So, if you're planning to make beautiful Panama your home in 2026, I bet you've already mapped out exactly what to do if a medical emergency hits. But let me ask you a much more practical question. How are you going to truly thrive here, month after month, year after year? Today's explainer isn't just about surviving the unexpected, it's about your everyday wellness. We're shifting the focus away from the emergency room, straight to your daily quality of life as an expat.
Almost 80 years. 79.8 to be exact, that's the current life expectancy down here in Panama, according to the Pan American Health Organization. The population here is aging beautifully, and what that means for you is managing your health, keeping up with preventative screenings, grabbing your daily medications. That's not a burden, it's just part of normal, long-term life here. We're talking about decades of enjoying the tropics, man. So getting your everyday wellness strategy locked in is absolutely vital.
All right, let's dive into this. We've got a highly organized 6-part roadmap for you today. We'll kick things off with a wellness reality, move into proactive care planning, and tackle managing chronic illness. Then we'll cover dental, vision, and therapies, uncover some hidden costs and logistics, and finally build your very own Panama wellness system.
Section 1. The wellness reality, moving beyond emergencies. Look, Panama offers incredible access to private hospitals, fantastic specialists, and extensive public health facilities. But here is the real secret to thriving in this hybrid public-private system. It works beautifully, sure, but only if you get organized before you actually need the care. With so many choices, you've got to be your own advocate. You simply can't wait for an emergency to figure out how the system works.
Now, the PAHO data reveals a pretty surprising reality. Over 71% of adults manage overweight conditions. Almost 20% have hypertension, and nearly 10% are navigating diabetes. Managing these conditions is not some rare exception down here, it's just everyday life for a huge portion of the population. So, going in for routine follow-ups, adjusting dosages, getting regular blood work done, that simply must be part of your long-term relocation plan. It's not about being sick, it's about staying well.
Moving on to Section 2. Proactive care planning, changing your mindset. Whether you're a digital nomad here for a few months or a retiree settling down for the long haul, you absolutely have to shift your mindset. That old habit of saying, whatever, I'll just deal with it later when I get back home, that completely falls apart when you realize you just need a simple dental cleaning, a routine lab panel, or a medication refill in your new country.
It's a total shift in thinking. Emergency thinking is constantly asking, where do I go if something bad happens? But everyday wellness, that asks, who follows my blood pressure? Who's reviewing my labs? By keeping your urgent, routine, and preventive care completely separate, you avoid overusing emergency rooms for stuff that a trusted primary doctor should be handling. Building that relationship early is the absolute cornerstone of proactive care.
My biggest piece of advice here, build your specific network of first calls before you ever even feel a symptom. You don't need to memorize every doctor in Panama, you just need your primary contacts mapped out. Keep one copy printed out in a folder on your desk and save everything right into your phone, especially their WhatsApp numbers. Seriously, here in Panama, WhatsApp is literally how everything gets done. You'll use it to book appointments, send your lab results, and even order prescriptions straight from the pharmacy.
Section 3. Managing chronic illness, building your team. If you're an expat managing heart disease, diabetes, or arthritis, you can absolutely live a wonderful, vibrant life here, no doubt. But you really have to treat your healthcare as a highly organized, routine system. Think of yourself as the general manager, building your very own medical team. To help that team succeed, you're going to need a medical summary with all the essentials. We're talking diagnoses, exact medication dosages, allergies, and past surgeries. Do yourself a favor and create this document in both English and Spanish. Because honestly, if your new Panamanian doctor can't see your baseline history and your recent labs, they're just going to have to repeat all those tests. And that doesn't just delay your care, it costs you valuable time and extra out-of-pocket money. Money that you could totally be spending on a nice dinner out in Amador instead. Knowing exactly where to get your care is half the battle.
If you live in beautiful, quieter spots like Bouquet, Petitcy, or Coronado, use your local clinics for the routine labs, minor ailments, and stable medication refills. But for complex diagnostics, specialist second opinions, or major imaging like an MRI, places like Hospital National or the Panama Clinic in Panama City, or the major healthcare hubs in David, well, those remain your logical escalation points. Essentially, you build a local team for the everyday stuff and a city team for the complex stuff. Let's slide into Section 4, Dental, Vision, and Therapies. Everyday care. Because as we know, wellness is way more than just visiting a physician. It's the everyday maintenance, the teeth cleanings, the eye exams, the physical therapy. That is what truly keeps us healthy, active, and thriving long-term in our new home.
Now, I know we all love a good deal, right? Especially when moving abroad. But please, do not go bargain hunting for complex dental implants like you're haggling for souvenirs at a local craft market. A lower cost is only a benefit when quality, safety, and continuity are strictly protected. Panama has absolutely fantastic dental and vision care, for sure, but you still need to vet your providers carefully. Check their credentials, ask about their sterilization standards, and always confirm warranties for major reconstructive work before you ever sit in that chair.
That brings us to Section 5, Hidden Costs and Logistics, Realities of Panamanian Healthcare. Look, relocating is a grand adventure, but man, it can be stressful when you don't fully know the landscape. And dealing with hidden frictions, like a sudden regional medication shortage, or figuring out the transportation time and hotel costs for 3 days of follow-up tests in David or Panama City, well, that all adds up. Let's be totally realistic about the logistics so nothing catches you off guard.
Check out this striking reality. Over 37%. According to PAHO, that is the percentage of Panama's total health expenditure that comes straight out of pocket. Even if you have stellar private insurance for those catastrophic emergencies, setting aside a dedicated self-pay budget for routine care, physical therapies, and regular doctor visits is absolutely vital here. A lot of expats actually choose high-deductible plans for the big stuff and just pay cash for the routine stuff because the local prices are generally very reasonable.
So you've really got to anticipate these common friction points. Specialist availability isn't equal everywhere. So always check the Ministry of Health, or MINSA, for regional service access before you decide to settle in a remote beach town. Also, keep in mind, even common daily medications can vary by brand name or dosage form down here. Do not wait until you're on your very last pill to find that out. Build a medication refill buffer, learn the generic names of your drugs, and have a chat with your doctor back home about acceptable substitutes early on.
And please keep in mind, this explainer is just one part of a much larger ecosystem of resources designed to help you navigate this whole transition. To dive deeper into the logistics and really master this system, you'll definitely want to check out the essential companions in our series. That's Blog 3 for your emergency routing, Blog 4 on navigating the public healthcare landscape, and Blog 8, which goes into pharmacy logistics and the economics of Law 6 in great detail. Together, they form your complete blueprint.
Which leads us perfectly into Section 6, your Panama Wellness System. We've talked about the challenges, the data, and the logistics. Now let's bring the whole shebang together. We are going to build a highly actionable, practical checklist that you can start implementing today, literally long before you ever need to see a doctor.
Okay, let's build your proactive care routine right now. First up, choose one primary doctor locally to coordinate all your care. Second, create an annual screening and lab calendar so absolutely nothing falls through the cracks. Third, identify just one specialist for each chronic condition you have and establish yourself as a patient there. Fourth, keep those digital and printed medical records fully updated and translated. And fifth, review your medication access well before your current refills run low. This is exactly how you turn uncertainty into a rock-solid plan.
So I'll leave you with this final thought. Is your wellness system ready for 2026? Don't wait for an emergency to find out. I highly encourage you to go read the full source text for all the detailed strategies and insights we discussed today. And make sure you catch our next explainer where we'll unpack pharmacy logistics in detail and show you exactly how to maximize those incredible pensionado discounts. Thanks so much for joining me, and hey, here's to a healthy, well-planned, and vibrant life in Panama.
Join IGO Panama, the largest community for tourists and expats in Panama, and get free access to trusted resources, our private Facebook group, and our verified directory.
This 8-part Panama healthcare series helps expats plan for care, from insurance and emergencies to hospitals, pharmacies, chronic conditions, and what to avoid before you need care.
If you found this helpful, explore more on iGo Panama. Visit and join www.igopanama.com/join.